Awesome. Welcome, welcome. I'm Angela, and if you're catching us on the replay, we welcome you as well. And you're always welcome to take down my information from this screen and email me or text me if you have any questions. Obviously, if you're here, you can put questions in the chat as we talk, or you're welcome to unmute. I'll pause a couple of times throughout, and we will address questions that you might have. I'm fastest at responding via text or typically on Facebook Messenger. Oh, good. Marion's here. So she's joining us. But I obviously email is fine too. I just get a lot of emails, like a lot of them. So just know that it might take me a little longer there to respond, sometimes a day or two. But via text, I'll usually respond the same day in between meetings and that. So again, thanks for joining us. I'm Angela. I'm with Young Living Essential Oils. I have been with Young Living for 10 years, officially 10 years in just under a month. But I was using the product and buying them off of my sister's account for about 3 months before that, 3 or 4. So last year, our company created a partnership with Clearwater, which is what we're here to talk about tonight. It is a healthcare company, and the goal or the purpose behind that was to help disrupt the quote unquote traditional healthcare system in America. And so I'm going to be talking a little bit more about that on different screens and that as we go through the presentation, but that's kind of a little bit of an introduction. Now, Clearwater is a healthcare vendor and they were established in 2018. The goal of Clearwater is to offer solutions other than traditional health insurance. So it's a nonprofit company. If you're familiar with nonprofits, what that means is that they can't make too much money. There are limits to the amount of money that they can make and have as profits in order to keep that status. They have tax benefits and things like that. So their goal is to actually serve us, the people, the members, and to put the money back into the organization to help keep costs low. So our monthly premiums, when we sign up for the healthcare plans that they offer, are used to pay medical bills versus make people uber wealthy that are at the top of a company. I came from 14 years in the medical field. I was a clinical technician. I worked with doctors and nurses. I worked in the operating room. And so I have seen a lot of behind the scene things that could be its own 30 minutes. It could be like way longer than that. So it's something that I'm pretty passionate about, helping people to see that there's a better way and doing as much education as I can to really do what this is offering, put healthcare decisions back into our hands as individuals, and again, disrupt the healthcare industry to give people other options because there are other options and they can be really good for a lot of us. What is a health share? It's a community of individuals that are helping to cover each other's medical expenses. So we pay a monthly premium that helps to cover those medical costs, and the contributions go into a pool, and then funds are paid out from there. So we have something that's a little bit different than traditional insurance. So we have an annual max when we choose the medical coverage. So in health insurance, you may be used to having a deductible, and then after you've reached that deductible, having a max out of pocket. So those aren't the same. You only have one amount that you're covering the costs of. And once you've achieved that, then after that, typically 100% of your medical expenses are covered unless you had some sort of pre-existing condition. And we'll talk about that in a few minutes on another slide. But like, let's say, for example, let's say you're really healthy, and so you sign up for the $5,000 annual max, and then you have a major medical situation where you need a surgery and you're in the hospital for a few days, and it costs $80,000 or something. You're going to cover the first 5,000 of that 100%, and the rest of it then would be shareable and covered at 100%. So that would be an example of that. Let me make sure. Vince, can you tell me if you can see my whole screen? Does it look okay the way that it's displayed here? Because I'm
Yeah,
not sure if like the images of people cut off your little boxes cut off the screen on the right.
yeah, I can see
Okay,
it.
perfect. Okay, thank you. So this is a little bit of a comparison. what is the health share compared to traditional health insurance? So again, kind of already introduced that the health share is a nonprofit business and health insurance is a for-profit business. So within the health insurance world, obviously people at the top are very wealthy. If you don't know that, it's very connected to our government. A lot of government officials support Western medicine initiatives, and healthcare companies or health insurance companies pay them a lot of money. So a lot of times there's limitations on who are the doctors you can see. In the health share, you can go to any doctor as long as they're licensed for what you are seeing them for. So, like if you want to see a chiropractor, as long as they're a licensed chiropractor, you can see them. There's not a list. These are the approved people. It's everybody. Same thing if you're going to like a naturopath or a doctor of osteopathic medicine or internal medicine, whatever the type of doctor is, as long as they are a doctor, they're licensed, then you're good to go. There's no different coverages. Again, with traditional insurance, you have like in network and out of network, and the coverage is different. Out of network is maybe covered at zero, depending on what your insurance is, that type of thing. Um, and then within the health share, claims are rarely denied. But within insurance, there are actually employees that are reviewing all the paperwork to look at errors and issues and mistakes to deny claims. That's their job. In the health share, the goal is to help us get things covered so that we stay happy and we pay the premiums, because that's where the money comes from, to keep everybody there and to keep everybody's costs as low as possible. And then again, it puts the healthcare decisions back in our hands because we're able to choose our own doctors and go wherever we want. This is my family's example. So it's the four of us. And as a little comparison of what we had with health insurance, we had Regence health insurance most recently. That's what the price of the monthly premium for 1,560 is that I'm referencing. And it's based off of age. There's a really loud noise outside of our house. But it's based off of age. So Garrett's 47, and that, but we both fall in the age range of 40 to 49. And then we have both medical coverage and holistic coverage. So a lot of times with traditional health insurance, you might have chiropractic. I just saw one last week. I was doing a comparison for a friend that they actually had acupuncture. It was the first time I had ever seen that. I think he had 6 or 10 visits a year, something like that. And he also had chiropractic. But as an individual, he was paying $908 a month. Ridiculous. Like he hadn't gone to the doctor in like 8 years, and he was paying that in a monthly premium. He had had no expense, no nothing. Last time he had something was like 15 years ago, and he was working and he got a splinter or a piece of wood or piece of a box or something in his eye and had to go to the doctor. That was an L&I claim. So he literally hasn't had anything other. I think maybe she said he had a cold. I was talking to his wife about it. It's just like, it's crazy to think that that's what people are paying for healthcare, and then not even needing it or using it. So anyway, I digress, but this is my family situation. When we had traditional health insurance with Regence, we had 12 chiropractic visits a year. Now we have 24 visits a year, and we can choose chiropractic or acupuncture. Previously, I didn't have that choice. I've never had acupuncture covered. And so when I was pregnant with my son and he was overdue, I went to the acupuncturist. I went 3 times and paid cash out of pocket every time. I think it was $155 per visit. So I'm like, man, I wish I would have known about this back then. But we saved on our deductible. So our annual max amounts are also decreased. So you can see that is significantly better for us. IV drips, if this is something that you're interested in, it is something that's covered, and it shows that obviously it wasn't before, because it's very much a proactive way to stay healthy. It's like getting liquid vitamins inserted into you. Telemedicine is covered. Sometimes it is with insurance, and it was with ours. And that telehealth for mental coverage, that wasn't something that was covered on our insurance. So it's something that's covered now. I actually had a friend whose sister died in January, and she used that service. She said it was super easy to schedule. They were really good, very kind. It was easy to get future visits scheduled, and it's really helped her. She's like, I am super grateful. She had signed up in December. She's like, I'm super grateful that I had it. And they're just really awesome. So I was like, awesome, good to hear that. I haven't used that service. So I told her, I'm like, I'm going to share your example. And then supplement coverage. So this is part of the Young Living partnership. So it's supplements from Young Living, but I'm going to teach you a secret, or not a secret. I'm going to teach you a trick in a few minutes when I talk about the health or the holistic side of it. So for a family, we get reimbursed for $75 a month of supplements and or essential oils. Individuals get $50, but again, like this is unheard of with health insurance, right? They don't help pay for supplements. And that, so not something that I ever had before, but I've been buying essential oils every month for 10 years. So I'm like, I'm delighted to have that extra benefit. So as you can see, our family's savings, again, with better healthcare, these are only some of the examples, but with better healthcare, better coverages, we're getting 605, just over $600 a month in savings for our monthly premiums. So huge savings for us. Then there's three different types of plans. So these three boxes represent them. The clear share is medical only coverage. So this is your major medical stuff. So like if you have an emergency room visit, something happens and you need a surgery, you're in the hospital, something like that. So major things. Holistic covers more of your proactive or your smaller everyday things. This is going to be the chiropractic, acupuncture, IV drips, supplements, it also is like your regular like doctor visits. So if you need to go for like an annual exam or uh, what's the word? I wasn't trying to think of say annual exam. Uh, Physical, annual physical, that type of thing. It also has prescription coverage. So there's generic prescriptions covered at 100%. And name brand is based upon the medicine because obviously there's thousands of medicines and it would be on a case by case basis because obviously huge variety. So if there's somebody who has pre-existing conditions, then as a nonprofit, they can choose, yes, we're going to provide coverage. No, we're not. So if you have a pre-existing condition, then you wouldn't necessarily qualify for that condition to be covered on ClearShare, the first one I talked about. So the medical coverages. So like, let's say you have back problems. Actually, this is a friend. I just enrolled her. She actually did both of them, but she has back problems. She's had a back surgery. She has a medical device that's implanted. It's actually the device that I used to represent and help doctors with in the operating room and that. But that's considered a pre-existing condition because she needs to see the doctor to make sure her device is functioning, that her back is okay um, once a year. And at some point, she knows that she's going to need a new device. So it's phased in, but in the beginning, for the first year, there's no coverage for that. So it can and it will have coverage eventually. So it's expected that she won't need another procedure for 5 to 7 years. And after 3 years, she'll be covered. So it's not that big of a deal. She's very much in the holistic approach. So she is using oils and supplements to help her stay as healthy as possible and to get as much life out of her device as needed. It's for chronic pain, for back pain. But the holistic portion, so if somebody has a pre-existing condition and they decide, I think I'm going to go the traditional health insurance route because I feel more comfortable with that, they can still get holistic. There are no pre-existing conditions with holistic because it's very clear. You get 24 visits to go to chiropractor and acupuncture, and there's not something covered beyond that. They are going to use their traditional insurance for it. I have somebody that is enrolling this month that has military insurance, but he's like, I'm not going to go on base. I'm not going to sit there. I'm not going to wait. I'm not going to play their games. And so he's actually doing the holistic side because he's like, if I had something major medical, then I would go. If I needed a surgery, I would go. But he's going to do the holistic side. It's also great for people who are over 65 years old. So people typically over 65 are going to have Medicare, but a lot of times they're usually going to have like an add-on or I think Humana in Washington is one of the most common, but they can get this instead and have really good care and coverage and go to any doctor they want. Or the third option, they can have a combination. So you can get the ClearShare, which is medical, holistic, which is your proactive approach to things, and that's what my family did. So again, we went from traditional medical insurance to having both and still saving the $600 a month. Any questions on this? I know I just talked really fast and said a whole bunch of things and want to make sure that you're all on the same page as me. So I'll give you a second if you want to unmute or if you want to type anything in the chat. You guys are easy. I like it. Okay. So, what is covered by ClearShare? Because I get this question all the time. Again, remember, there's no network. If you have accidents, if you have an emergency room visit, a hospital stay, the telemedicine is 24/7, 365 days a year. The virtual mental health sessions, $0. It's included in the monthly premium. Um, the care coordination is a department within ClearShare or within Clearwater that helps you if you have a situation that's something like major medical and you need help making sure that you're getting the best price, negotiating prices, or something like that. So, one example, there's this guy who had needed a hip replacement surgery, and I'm pretty sure he had the $5,000 annual max, and he was going to get the surgery at a hospital, and it was quoted at $80,000. So care coordination helped him to do some research and discovered that his doctor also does the surgery at a surgery center, and the cost would be $40,000. Duh, of course he did it, right? So, and the benefit to that using this department is when they do find something for you and it saves the organization as a whole money, then you also waive your annual max for that procedure. So he went from costing the group as a whole 80,000 to 40,000. So they covered it at 100% and he didn't have to pay his 5,000 for that procedure. So that's huge, huge, huge. Pregnancy and postpartum is covered. You can give birth anywhere you want, at home, hospital, a birth center. Again, that's probably a pretty big difference compared to a lot of insurances and that. But home health care, pain management injection, hormone therapy injections, medical supplies, nutritionist services, international medical treatment. So if you travel and you're outside of the United States and you have traditional insurance, you don't like it's not covered. You need to buy travel insurance when you're going on vacation. If you're going on a cruise or to another country, this, you go, you get your service, you get an invoice, and you probably have to pay while you're there, international. But you get an invoice, you turn it in, and you get reimbursed. So you are covered wherever you are. Occupational therapy and physical therapy, speech and massage therapy, inpatient or outpatient hyperbaric, medical equipment, durable medical equipment, skilled nursing facilities, hospice care, and weight reduction. So keep in mind that if you get the policy, and one of these are the medical things, so like pain management injections, you can't have that condition be a pre-existing condition. But if you get the policy and say in 6 months something happens and you need an injection, then it's covered as long as it's a new thing. Does that make sense? Cool. On the holistic portion, this is a little bit of kind of what I introduced and shared because my family uses this a lot, but I like to share this and the specifics. Again, the Young Living oils and supplements is $50 for individuals, $75 for couples. This is per month. The primary care visits would be that you pay $20. So the $20 is kind of like a copay, and then it's covered up to $150 per visit. Anything on this holistic side of the plan is like when you go for the appointment, you pay for it, you get a receipt, you turn in the receipt, and then you get reimbursed for whatever portion is beyond your requirement or your portion that you're responsible for. So, like for example, let's say you go to the doctor and say it's and even $150, you would get the receipt after you've paid for it, an actual receipt, not just like a credit card printout, but it has to show like the doctor's office letterhead, have their information on it and that. So you turn that in, and if it was $150, you would get reimbursed 130. Sometimes the average that they say for those reimbursements is 30 to 45 days. For my family, at the end of last year, there were some that were taking 7 weeks, so they got behind, and I think that's typical. Um, but right now, I had one that I got in about I was like 7 or 8 days. It was super fast. I get it electronically, get it in my bank account. I have that information saved on my portal, and I just tell them that that's how I want reimbursed, and it happens super fast. So I've been really happy with that. But I like to set the standard of 30 to 45 days being the average. Breast imaging is covered. Again, this is another big difference from traditional health insurance is that you can choose if you want thermography or a mammogram. Thermography has less radiation exposure, and there are other benefits to it. I was doing this personally. I've gone twice before I had my plan, and I paid cash out of pocket because it wasn't covered by my health insurance. So that's something that is a nice added feature. Chiropractic care, acupuncture, again, there's a couple of holistic options, but with the full holistic option, which is what my family did, each of us gets 24 visits a year, and it's our choice how many times of that 24 we go to the chiropractor, how many times we go to acupuncture. We could go 23 times to the chiropractor and one to the acupuncture within the year. IV drips, I haven't gone to do this yet. There's only like 4 places near where we are, and they're actually not even near, at least 30-minute drive, and some of them are like 45 to an hour. But I need to go try that so I can tell people about it. So I will someday. And then prescriptions, as I mentioned, generic prescriptions covered at 100%, name brand, dependent on the brand or the medication. So any questions on this screen? I want to pause again and give you a moment to unmute. And while you're unmuting or typing in questions, if you have them in the chat, I also want to make sure I share that you need to reimburse or you need to submit your receipts within 30 days for reimbursement. So you can't save up all your receipts for the year and submit them at the end of the year. You do need to submit them every 30 days. And I actually send a text message reminder to make sure that you're doing that once a month. Okay. The holistic savings option is, and I'll pull up pricing on screens here in just a few minutes. But holistic savings is a more cost-effective option. If you're like, I'm not going to go to the chiropractor or acupuncture 24 times a year. That's the biggest difference. But maybe some of the other services you don't need either. So it still gives the oil and supplement reimbursement, primary care visits, and then the chiropractic and acupuncture is half. It's 12 visits a year, and it's your choice between the two. But it doesn't have the prescriptions, it doesn't have the IV drip, and it doesn't have the breast imaging. That's the other one. I always forget that. So it's a more cost-effective monthly premium that I'll pull up here in a little bit. So here is the plan sharing options. So on this screen, you're going to first look at what age group do you fall into. So are you 18 to 29, 30 to 39, 40 to 49, or 50 to 64? And this is for the medical coverage only. And then in the columns as you're moving across, you decide, okay, am I comfortable with a $5,000 annual max, a $2,500, or $1,000? My family does 2,500 and that. So like, let's say, for example, for us, we fall into the age 40 to 49. We're a family with kids because you're also going to then look at which category do you fall under here. And we did the 2,500. So if we were to do the medical coverage only, our cost could be just $560. So that's almost like the comparable apples to apples, or not exactly, because we did have some of the other services available on our traditional insurance, but it could be as cheap as $560 a month if we were to do this. Obviously, I'm very into natural and healthy, crunchy alternative lifestyles, so that's why I did both. But I'm pausing here and kind of talking, so you can take a screenshot, you can zoom in if you need to. That type of thing, because I know it's a lot of information, and to get to your category can take a second. So give one more second here before I go to the next one. Okay, clicking forward. This one is if you want holistic only. So again, if you have a pre-existing condition, you have traditional health insurance, and you're looking for something to give you this more alternative type of thing. If you're over the age of 65 and you have Medicare, that type of thing. So again, here this one doesn't have an age range because it's the same for everybody. Single, if you're married, if you're single with kids, or your family with kids. So those are the options there. And now we move into the combination. So this is holistic savings and the medical clear share coverage. So it's the same. You look through the category, your age group. On the medical side, which of the annual maxes are you comfortable with? And what classification are you? So are you looking for coverage for yourself, coverage for the family, that type of thing? And so this is something that's interesting, and it's also different for insurance, is that you can cover whoever you want, and you can make changes over time. So let's say you're going to get coverage for yourself as a single individual right now, but then in 3 months, something changes and you want to get coverage. You don't have to have a qualified life event to change coverage and add a family member. The only thing that you can't change within the year is your annual max, because they don't want somebody signing up for a $5,000 annual max, not having any pre-existing conditions, then having something come up and moving it down to $1,000. Like, oh, I have this really expensive thing. I know that it's going to save me tons of money. So they don't allow us to make that change unless it's open enrollment, which is at the end of the year, or it's our plan renewal. So if you were to get a plan and start in like April or May next year at your annual renewal, you can make changes, or you can make changes at open enrollment at the end of the year to that piece of it. This is if you want the full holistic plan plus the clear share. So again, holistic plus medical on that option. And again, this is what my family does. And I think I don't remember back on the other screen. Mine I think is a little more than that too, because I do vision for my family as well. Because I think mine is like $965 a month, if I remember right. I also like to share this screen and explain family annual maxes. So this really is beneficial for larger families, but like for my family, so I say we did the 2,500 annual max. It's not 2,500 per person. It maxes out at 3 people. So as you can see, a member plus family, 7,500. So it's not, again, per person. My family of 4 would be 10,000 if that was the case, but it maxes out at this, and it's not going to be more than 2,500 for an individual, each person on the plan, if that makes sense. This goes towards your major stuff, your medical stuff, not the holistic side separated. And then coming soon, there's going to be an option for a $10,000 annual max as well. My thought, like my family's been saving a little bit of extra. Obviously, we're saving $600 a month on our monthly premiums. So I've been putting extra money. We keep a completely separate account for all of this. We pay our premiums, pay our doctor bills, get it reimbursed back into that account. And we're building up that account. So my thought at the end of this year, we'll probably move up to the $5,000 annual max. And then a year later, we'll probably move it up to the $10,000 annual max just to keep saving more on our monthly premium since we're healthy. Vision and dental is an option. For my family, we did the vision option. We kept our old dental because it was a little bit cheaper monthly. And I'm pretty sure my daughter might need braces because I let her have a pacifier too long. And so she has some upper stuff. And so I'm like hoping that I can correct that naturally, but we'll see. So how does it work? Clearwater is the company that administers it. The relationship with Young Living is what gets us this pricing. And so first thing you do is you become a customer through Young Living. You can do that by getting a totally free account. You don't ever have to buy anything from Young Living if you don't want to. If you're going to get the holistic side, you can obviously get reimbursed for oils and supplements that you buy each month if you choose to do that. But you sign up for the health plan and the reimbursement, the payment for the monthly premium, portal access, all of that is through the Clearwater website. So you get Young Living, then you get your Clearwater account. So it's kind of like setting up 2 accounts to get that pricing and all the details that we talked about tonight. When you sign up for the plan, if you signed up now or in the next 11 days, your coverage could start on April 1st. So you sign up, your coverage begins on the 1st of the following month, and your first payment comes out around the 9th or the 10th, whatever the whatever business day falls during the week for the charges. So super simple. I love that you actually have coverage and you can start getting benefits before you actually have to pay your first premium. And then you submit receipts online. You actually do get like what looks like real health insurance cards. Again, it's not health insurance, but it's what we're used to them looking like. So if you did go to the hospital and had something major medical going on, you could give it to them and then they could get connected to Clearwater to know and understand your coverages. And that's me. I'll give you a moment. Look at that. I went 5:31. So just over 30 minutes. And so you can see why I talk fast. I share a lot of information. But this, again, is my information. If you have any questions, I'll give you a moment to unmute. And then I'm also happy to send you the replay if you want to rewatch or watch with a spouse, that type of thing. Or you just need to absorb the information again. Nothing at all? All right, you guys are easy. So thanks again for joining. I'll check in with you. And if you have questions that you want to answer one-on-one or more privately, or if you have any pre-existing conditions that you want me to share specifics with you on, I'm happy to do that. And I'll go ahead and stop the screen share and stop our recording and say thank you.